Hello viewers, welcome back. This is Dr. Abid Sargani. Viewers, in today's lecture we are going to discuss about canine parvovirus or simply canine parvovirus in dogs. So at the end of this lecture you will be able to learn about what is canine parvovirus or introduction of canine parvovirus, etiology of the canine parvovirus, susceptible breeds of the dogs to canine parvovirus infection, risk or predisposing factors which predispose these dogs to the infection of canine parvovirus, transmission of the canine parvovirus or spread of canine parvovirus from one infected dog to next one, and pathophysiology of canine parvovirus, how it infects the dogs or the which systems it can infect and what causes the clinical signs. After that, necropsy findings if dog dies of this disease, and diagnosis of canine parvovirus, treatment options, the goal of treating the canine parvovirus, and what are the complications of canine parvovirus enteritis, and prognosis of the canine parvovirus means mortality or morbidity and recovery chances of the canine parvovirus, and at the end we will learn about the prevention and control of canine parvovirus. So it's my request that please watch this video till the end of this lecture, and hopefully we will enjoy throughout this lecture, and let's learn together. So first of all, what is canine parvovirus? So the canine parvovirus is a highly contagious virus that commonly causes acute infectious gastrointestinal disease in young and unvaccinated dogs. So it means this is a preventable disease and vaccination is available, and presenting signs include anorexia, lethargy, vomiting and diarrhea, which is often hemorrhagic. Diarrhea is often hemorrhagic, and some of the odor smell may be failed. Diagnosis is typically based on history of the patient, physical examination findings and fecal antigen testing. Treatment is largely supportive on an inpatient or outpatient basis because specific therapies to this virus does not exist. So if we talk about the etiology or causative agent of the canine parvovirus, although its exact origin is unknown, but it is believed to have arisen from the feline panleukopenia virus, which infects mainly the cats. Characteristically, it is non-enveloped single-stranded DNA virus, and it is resistant to many of the common detergents, disinfectants, as well as to the changes in temperature and pH. So the infectious canine parvovirus can persist indoors at room temperature for at least 2 months, and outdoors if protected from the sunlight and desiccation it can persist for many months and possibly years. While in North America, clinical disease is largely attributed to canine parvovirus 2b, however, infection with newer and equally virulent strain canine parvovirus 2c is increasingly common, having been identified in at least 15 states of America. So the susceptible breeds of dogs to the canine parvovirus. So the canine parvovirus can affect the following breeds, but younger puppies between the age of 6 weeks to 6 months and unvaccinated or incomplete vaccinated dogs are most susceptible. Breeds described as at increased risk includes Rottweilers, Doberman Pinschers, American Pit Bull Terriers, English Springer Spaniels, German Shepherd. So the susceptibility to infection increases as maternally acquired antibodies wanes. So the antibodies can be passively transmitted from the pregnant mother to the puppies during the whelping. But it wanes, antibodies wanes after few time. And possible risk factors predisposing to the canine parvovirus includes number 1 stress from weaning, overcrowding and malnutrition, concurrent intestinal parasitism, enteric pathogenic infection just like Clostridial species, Campylobacter species, Salmonella, Giardia and coronavirus have been associated with more severe clinical signs. And among dogs greater than 6 months old, intact male dogs are more likely than intact female dogs to develop the canine parvovirus enteritis. It means that male dogs are more prone to this disease than the female dogs intact. If they are castrated or spaying is done, then the predisposition to this disease can be reduced to a limit. Next one is transmission or spread of the canine parvovirus or the prevalence of canine parvovirus, how it can be transmitted from an infected dog to healthy dogs. Some questions are asked that can a veterinarian be source of infection? Of course, he can be source of infection if he does not cares about the hygienically or biosecurity measures are not followed by teaching the infection, or gloves are not weared during handling the parvovirus infection, then he may retain the virus and can transmit to another healthy infection brought for the vaccination or physical checkup. So the infection is acquired through the direct oral or nasal route contact with virus containing feces, or indirectly it may be transmitted through contact with virus contaminated fomites, just like environmental transmission, personnel and equipments. Virus is shed in the feces of infected dogs within 4 to 5 days of exposure, often before the clinical signs develop and throughout the period of illness and for approximately 10 days after clinical recovery. So the focus should be taken throughout this period to prevent the further spread of the canine parvovirus. Now if we talk about the pathophysiology of the parvovirus, first of all, viral replication occurs initially in the lymphoid tissue of oropharynx. As I already mentioned that it is transmitted through the oral to nasal route. Then the replication occurs in lymphoid tissue of the oropharynx with systemic illness resulting from the subsequent hematogenous dissemination. Canine parvovirus preferentially infects and destroys rapidly dividing cells of the small intestine like crypt epithelium, lymphopoietic tissues and bone marrows. At the end, destruction of the intestinal crypt epithelium results in the epithelial necrosis, villus atrophy. Atrophy means reduced in size. The villus will be diminished in size, which ultimately causes the absorption problems of the nutrition, impaired absorptive capacity and disrupted gut barrier function. So as gut mucosal membrane works as a first line of defense with the potential for bacterial translocation and bacteria ultimately developed at the later stages of this infection if the intestinal wall has been disrupted. Further, Lymphopenia and neutropenia develops secondary to the destruction of hematopoietic progenitor cells in the bone marrow and lymphopoietic tissues just like thymus, lymph nodes, etc., and are further exacerbated by an increased systemic demand for the leukocytes. And infection in the utero or in pups less than 8 weeks old are born to unvaccinated dames without naturally occurring antibodies can result in the myocardial infection, necrosis, and myocarditis. Myocarditis presenting an acute cardiopulmonary failure or delayed progressive cardiac failure can be seen with or without signs of the enteritis, means inflammation of the intestine, and myocarditis refers to the inflammation of myocardium. However, canine parvovirus 2 myocarditis is infrequent because most of the bitches have canine parvovirus antibodies from immunization or through the natural active immunity. Now, after pathophysiology, clinical signs or symptoms of the canine parvovirus develops. Now, the clinical signs of parvoviral enteritis generally develops within 5 to 7 days of infection but can range from the 2 to 14 days. So, we may call that incubation period of this disease is 5 to 7 days or 2 to 14 days. And initial clinical signs may be not specific, just like lethargy, anorexia, and fever, with progression to the vomiting and hemorrhagic small bowel diarrhea within 24 to 48 hours. Approximately 25% of dogs may have non-hemorrhagic diarrhea. So usually in the 75% of the cases of canine parvovirus, dogs brought with hemorrhagic diarrhea, but it should not be confused that it may occur in dogs without hemorrhagic diarrhea. So the physical examination finding can include depression, fever, dehydration, and intestinal loops that are dilated and fluid filled. Abdominal pain warrants further investigation to exclude the potential complication of intussusception. In severely affected animals, dogs may present with collapsed with prolonged capillary refill time. Capillary refill time usually enhanced due to dehydration, poor pulse rate and tachycardia, increased heart rate, and hypothermia, means temperature below the normal level. Signs potentially consist with septic shock. Although canine parvovirus associated leukoencephalomalacia has been repeated, and central nervous system signs are more commonly attributable to the hypoglycemia, means reduced glucose level in blood, and sepsis, chances of increased infection in blood, or acid base and electrolyte abnormalities due to diarrhea and vomiting. Inapparent or subclinical infections is common in canine parvovirus. Now the necropsy findings are the lesions of canine parvovirus affected dogs. Grossly, necropsy lesions of canine parvovirus can include a thickened and discolored intestinal walls, watery, mucoid or hemorrhagic intestinal content, edema and congestion of the abdominal and thoracic lymph nodes. Thymic atrophy, means reduced in size of the thymus. In the case of canine parvovirus myocarditis, pale streaks in the myocardium may be seen. But histologically, intestinal lesions are characterized by multifocal necrosis of crypt epithelium, loss of the crypt architecture, and villous blunting and slowing, and depletion of the lymphoid tissue and cortical lymphocytes results in cortical lymphocytes and Peyer's patches, peripheral lymph nodes, mesenteric lymph nodes, thymus, and spleen. and bone marrow hypoplasia are also seen. Hypoplasia refers to the decreased in number of cells, which ultimately reduction in the size of the tissues. Necropsy findings are lesions further describes pulmonary edema, alveolitis, inflammation of alveoli, and bacterial colonization of lungs and liver may be seen in dogs that died of complicating acute respiratory distress syndrome, systemic inflammatory response syndrome, endotoxemia, and septicemia. Now, the diagnosis of canine parvovirus is based on signalement, history of the clinical signs and disease occurrence, confirmation by the fecal parvoviral antigen testing or viral PCR. These are the two means through which we can diagnose the canine parvovirus in dogs. Now in detail, diagnosis of canine parvovirus. Perirenal azotemia means increased biliary nitrogen. Hypoalbuminemia means gastrointestinal protein loss. Hyponatremia, reduction in the sodium level. Hypokalemia, potassium level is reduced. And hypochloremia, chloride ions is reduced. And hypoglycemia and glucose reduction due to inadequate glycogen stores in young puppies and or sepsis potentially are poor prognostic indicator, and increased liver enzyme activities may be noted on the serum biochemical profile. So these are the biochemistry analysis of the canine parvovirus infected dogs. And commercial ELISA enzyme linked immunosorbent assays for detection of antigen and feces are widely available and have a good to excellent sensitivity and specificity even for the more recently evolved canine parvovirus 2C strain. Further alternative ways to detect the canine parvovirus antigen in feces includes polymerase chain reaction testing, electron microscopy, and virus isolation. Further serodiagnosis of canine parvovirus infection requires demonstration of a fourfold increase in serum immunoglobulin G titer throughout a 14-day period of or detection of anti-immunoglobulin M antibodies in the absence of recent vaccination, and this test is rarely used. Now, the important thing to be noted is that treatment of the canine parvovirus. How you can treat the canine parvovirus infected dogs or puppies. Mainly, there is no particular treatment for this virus, but treatment is based on supportive care, which includes fluid and electrolyte therapy, just like normal saline is given as a fluid or fluid substitute. Nutritional support through lactated ringer and intravenous infusion, antiemetics and antibiotics are given. Let us further explore the treatment of canine parvovirus. Now, what are the goals for the treatment of canine parvovirus enteritis? The main goal of treatment for canine parvovirus enteritis includes restoration of the fluid, means to overcome or restore the dehydration. Electrolyte imbalance occurs in the mainly diarrhea. We should focus to restore the electrolytes and metabolic abnormalities and prevention of the secondary bacterial infection. So the main goal for treatment of canine parvovirus includes these. Now the treatment options. What are the possible treatment options for the canine parvovirus? Number 1, beta-lactam antibiotics are given, just like example ampicillin or cefazolin 22 mg per kg intravenous 3 times daily will provide appropriate gram-positive and anaerobic coverage to prevent from the secondary infections. For severe clinical signs or marked neutropenia, additional gram-negative coverage can be given through the enrofloxacin 5 to 10 mg per kg per day intramuscular or intravenous, or gentamicin belonging to the aminoglycosides 9 to 12 mg per kg per day intravenous is indicated. It should be noted that enrofloxacin has been associated with articular cartilage damage in rapidly growing dogs 2 to 8 months old and should be discontinued if joint pain or the swelling develops. Second or third generation cephalosporins, just like cefoxitin, ceftazidime, cefovecin, and others, can also be considered for their relatively wide spectrum of activity against gram-positive and negative bacteria are given. An antibiotic therapy is typically only needed for short duration of around 5 to 7 days, not more than this. Now, antiemetics therapy. Antiemetics means those drugs which are used to control the vomiting in the dogs is indicated if vomiting is protracted, perpetuates the dehydration and electrolyte abnormalities are limits of oral administration of medications and nutritional support. In dogs with canine parvovirus enteritis, meropetent 1 mg per kg per day intravenous and ondansetron 0.5 mg per kg intravenous 3 times daily appear to be equally effective at controlling the vomiting. Or other than this, metoclopramide 0.3 mg per kg per use means orally or subcut twice daily or 1 to 2 mg per kg as a constant rate infusion may be considered as an antiemetic as well as for its prokinetic effects, particularly in dogs with the significant gastric stasis. Vomiting may persist despite the antiemetic administration. So far, in these cases, evaluation for other causes of vomiting such as intussusception may be warranted. While antidiarrheals are not recommended in this canine parvovirus disease because retention of intestinal contents within a compromised gut increases the risk of bacterial translocation and systemic complications. So avoid to use the antidiarrheals, but sometimes we use the metronidazole. It should be avoided. For anorectic dogs, treatment of canine parvovirus includes placement of the nasoesophageal or nasogastric tube for the continual feeding of prepared liquid diet, either commercial liquid diet or dilute blended canned food. Should be instituted within 12 hours of hospital admission, and once vomiting has subsided for 12 to 24 hours, gradual reintroduction of water and a bland, low-fat, easily digestible, commercial, homemade or home remedy, just example boiled chicken or low-fat cottage cheese and rice diet is recommended. Partial or the total parental nutrition is reserved for dogs with anorexia greater than 3 days that cannot tolerate the enteral feeding. Now, what are the complications of canine parvovirus enteritis? Complications include intussusception, bacterial colonization of the intravenous catheters, thrombosis or thrombus formation in the blood vessels, urinary tract infections, septicemia, endotoxemia, acute respiratory distress syndrome, and sudden death are potential complications of the canine parvovirus enteritis. Now, what is the prognosis of the canine parvovirus? Sometimes it is frequently asked by pet owners that will my puppy survive or recover or not? So in most of the puppies that survive the first 3 to 4 days of illness make full recovery usually within 1 week of treatment, and with appropriate supportive care 70 to 90% of dogs with canine parvovirus enteritis will survive. and dogs that recover may develop long-term, possibly lifelong immunity. So it is not of critical condition. Now the prevention and control of canine parvovirus. For prevention, to limit the environmental contamination and spread to the other susceptible animals, and dogs with the confirmed or suspected canine parvovirus enteritis must be handled with strict isolation procedures. Example in isolation, housing, gowning and gluing of personnel, frequent and thorough cleaning, and foot baths, etc. All of the surfaces should be cleaned of gross organic matter and then disinfected with the solution of dilute bleach 1:1:30 or per oxygen, potassium peroxymonosulfate or accelerate hydrogen peroxide disinfectant. Then the same solutions may be used as a foot bath to disinfect the footwears. And to prevent and control the canine parvovirus, vaccination is available. Vaccination with a modified live vaccine is recommended at 6 to 8 weeks first dose, 10 to 12 weeks, and then 14 to 16 weeks of age, which is followed by a booster administration 1 year later and then after every 3 years. So canine parvovirus is a preventable disease. Thank you very much for watching my videos. Any question regarding today's lecture you may ask in comment box, and thank you very much for your kind support.